So, 4 long years of studying, testing, preclinicals, clinicals, and getting all of your graduation requirements, passing your boards and licensing exams. I suppose you're probably pretty excited to graduate.
Yeah.
I'm sure you've been interviewing and figuring out where you're going to be working now, right? So, where are you going to be practicing after graduation?
Mother.
There are literally so many hoops to jump through in dental school, and it's just stuff that basically we're never gonna do when we get out of here.
The screening questions are the worst.
I'm sorry we have to ask all these questions, but with that one Ebola case in Dallas a few years ago, you can never really be too careful. Anyway, do you currently have a fever?
No.
Have you ever been in contact with anyone that may have Ebola?
No.
Have you been to Guinea, Liberia, or Sierra Leone recently?
No. No.
Do you know anyone who has been to Africa ever?
No.
Have you dreamed about Ebola?
No.
Have you ever searched Ebola on Google?
No.
Now, these next questions are about your parents. Is your mother living or deceased?
My mother passed away 2 months ago, actually.
I'm so sorry to hear that. But how are her teeth?
So, obviously dental school is really stressful, but, you know, being here 4 years, you sort of figure out some tips and tricks to get through it.
Like, at first, we all hated that we had to skip lunch a lot between clinics, you know, setting up between patients, but we've kind of figured some ways around that.
Alright, well, I just need to go grab a faculty for PTP. I'll be right back. Alrighty, I got PTP. We're doing a filling on the lower left today. I'm gonna go grab some local anesthesia and we'll get you all numbed up, okay? You have any questions or comments for me?
Actually.
All right, it's time for everyone's favorite segment.
What's that stain?
That's right. Welcome to What's That Stain? The game where we show you some nasty dental scrubs and you try and guess where those stains came from. And here's your host, OUCOD.
Alright, contestants, let's take a look at our first stain. Ooh, that is gnarly. Alright, contestants, it's time to answer the question that's on all our minds. What's that stain? Is it A, radiograph fixer, B, developer fluid, C, bleach, or D, tray adhesive? Alright, let's take a look at your answers. Casey chose B, developer fluid, and Cal chose A, radiograph fixer. Ooh, sorry, the answer is actually D, tray adhesive.
Hey, can someone assist me with amalgam bond for a few minutes?
Sorry, I'm keeping this buccal pit dry.
What's your patient's name?
Oh, this is John Kirkpatrick.
Okay.
Quite an appointment today. 4 hours and about four and a half hours.
Well, we appreciate you being here. Tim, you have your planned appointment this time?
Yes, I
You're
did.
sure you have the planned appointment for your scheduler to schedule the appointment? You're sure because the last 6 or 7 times you didn't have anything.
Well, I have it approved. I know I have it approved.
Do
So we
you
should be
know
good
the
to schedule.
difference between approved and planned?
I think so.
Okay, well, I'm not seeing your planned appointment. Tim, I'm done. Come back when you're 3rd year and we'll make an appointment.
We're doing a lot of things today. The operative, perio. I'm going to try and get some RPD in there too. So could you get an RPD kit for me? Thank you so much.
Oh
you're so welcome.
I'm sorry about that, guys.
Come on, Scott.
It's one more thing. Don't worry.
It's been 10 minutes.
Always one more thing. Thank you so much. I think that's everything.
Trying to avoid using dental jargon with patients can be tough sometimes, especially when they've been pounding it in our head for the last couple of years.
So I've spent the last fortnight diagnosing your periopical and bite wing radiographs, and I couldn't help but notice that on the distal of number 19, you seem to have an overhang in that, that full coverage, type 3 high noble restoration. If we were to allow that to remain in its normal state, it could provoke an inflammatory response, which could create some, cytokines in the area, IL-6, TNF-alpha, and that could really decrease the prognosis of the periodontium in that immediate area. It's my professional opinion that we go ahead and refabricate that full coverage restoration. I think you'd be a really good candidate for something like our Genco 58. Do you concur?
Yeah. My wife's worried that I'm drinking too much brake fluid. I told her I could stop at any time.
Man, I am thirsty.
Hi, Thirsty. I'm Dr. Shaded. I was gonna ride my bike today, but then I was too tired. Too tired?
Oh, hey, Dr. Jacobson, how are you?
Great, how are you?
I just was wondering if you wanted to take a look at my model. I worked real hard at it.
Sure.
Here you go.
Let's take a look, Khaled.
Yeah.
Okay, well this looks really nice. You've got a great land area. Looks like you took a really nice impression. Good extensions, really nicely trimmed, Khaled. Looks like you did a great job.
Thank you. I was wondering if you can take a look at it, maybe grade it.
Sure, do you have a grade sheet?
Oh yeah, hold on one second. Here you go. Thank you so much. I appreciate it. Thank you. Dr. Jacobson?
Hey, Dr. Seiler?
Oh, hey, Scott.
I've got this prep. If you can take a look at it for me.
Oh, yeah, sure. Now, did we talk about this?
Yeah, we did. Yeah.
Okay. Let me put my big eyes on.
All right.
All right now. Well, can't quite see. Let me shift to 300 magnification.
Okay.
And, now, first thing I see, Scott, there's an undercut.
Oh.
So you need to fix that.
All right.
Mesiodistally, you're a little bit narrow.
All right.
Buccolingually, your prep. It's a little over tapered and it's a little narrow.
Okay.
Your margin all the way around there is well, how do I say this? It's a little narrow. And
okay.
That mesiobuccal margin, you're about 20 microns off, or about the width of a red blood cell. Overall, it needs a lot of improvement. Just go ahead and fix those things and you might get a passing grade, but overall, I suggest you just restart and redo the whole thing.
Okay.
For an extra challenge, the remaining questions were written by OU faculty members. Let's take a look at our next stain. Is it A, astringent, B, fixer, C, developer fluid, D, sodium hypochlorite, E, A and B, F, B and C, G, C or D, H, B and D, I, A, B, and D, J, BC, or tray adhesive? Alright, let's see your answer choices. E and J. Let's see if you got it right. Ooh, it's actually I. A, B, and D.
Despite being experts in the oral health field, sometimes we don't even follow our own recommendations.
The best way for us to cut down on these cavities is to reduce your soda consumption. You know, sugary drinks contribute quite a bit to cavity formation. You know, the pH gets lower, the acid in the soda, it starts.
I need this.
And the correct answer is I. A, B, and D are more aesthetically pleasing than what? I have no idea, but that is the correct answer.
Looking back, it's funny to see how much we've changed in the last 4 years.
You guys know when they're gonna post the grades?
I don't know. I've been studying all night and I'm so stressed out.
This quiz is worth 3% of our grade. 3%! If I fail this, I'm screwed.
Refresh.
And Dr. Miller gave me a clinically acceptable operative project.
Are you serious?
Yeah, I couldn't believe it. You know, he's so nice, but that prep was amazing.
Ridiculous.
Yeah.
So how many quizzes and tests do we have tomorrow? I think it's only 4.
Way better than yesterday when we had 7.
I can't wait to sleep an hour tonight.
Hey guys, check it out. 7.2, clinically acceptable.
Congrats!
It's my birthday. It's my
Did
birthday.
someone say clinically acceptable? All right!
You know, I'm trying to get someone to sign off on the 7-12 crowd, but I haven't found Dr. Osaka anywhere.
Yeah, I feel like we have a test this week. What class is it in again?
Guess we have a test today. Can I use your hose?
You still use a vacuum mixer?
You still use a bowl?
A. Statement 1 is true. Statement 2 is false. B. Statement 1 is false. Statement 2 is true. C. Both statement 1 and 2 are true. Statement 3 is false. D. Statements 1, 2, and 3 are sometimes true. E. Statements 2 and 3 are false, but statement 1 can be false. Let's see what the correct answer is. B. Oh, I'm sorry, ladies.
In our class, there's an interesting distribution of sports skills amongst the students.
On one side, there's the athletes. Then on the other side, there's the rest of the class. And they're all pretty terrible at sports. Not very good at all.
Oh, hey, will you toss me some of the microstone?
Yeah. Oh, sorry.
So there's one thing that unites our class, something we all agree on, our hatred for the foosball table.
Foosball? I freaking hate that table.
I hate the foosball table! It's so loud and so freaking annoying.
Every other class above or behind us loves to play foosball, even if it's for a 5-minute break between lectures.
I'm so sorry, I'm gonna have to move you to Thursday. But before that, I need a full list of all of your medications.
Right now, let's do it. Come on, we'll get some foosball. All right, let's go.
Who wants some? Okay, so you said that you have type 2 diabetes. Is that right? What was your most recent HbA1c?
You don't want none.
It was 6.
Foosball. I know, I can't get anything done in there. Now I try to call my patient, people come in, start playing foosball. Jeez, it's crazy.
Our class is the only class that doesn't play that wretched thing, and I'm proud of it.
B. Statement 2 is false. Statement 2 is true. C. Neither statement 1 and 2 are true, and statement 2 is never sometimes false. D. Statements 1 and 2 are sometimes true. E. Statement 2 is false, but also can be true. F. C is the correct answer. All right, let's see our answers. Carrie S. Lesion chose F. C is the correct answer. Ooh, I'm sorry, but C is the correct answer. Saliva, congratulations, you're today's winner.
Thanks, Al. Big fan.
All right, Tyler, let's see what he has won. Oh, it looks like it's a jar of extracted teeth for Indo. But let's be honest, the best ones have probably already been taken out. Anyway, we'll see you next time on What's That Stain?
Ugh, speaking of boards, I have never been so stressed out in my entire life.
I got a question. Why did our school get accredited, but Reb has to tell me if I'm competent to do dentistry?
I'm sorry, my brain's not working. What was the question?
Just wanted to know what you were doing for lunch.
Oh, I haven't eaten in 2 weeks. I have no idea.
So, you all have complained a lot. I hope that at least you've enjoyed some of the dental school.
Yeah, for the most part, dental school's been fantastic. I mean, yes, it's been hard. It's really pushed me sometimes, even to the limit. But, you know, I wouldn't trade it for the world. We made great friendships here.
Lame.
We've had faculty and staff that really pushed us to be the best that we can be, the best possible dentists.
Lame.
And then for the most part, I'd say it's really prepared me to go out into the communities and serve the people that we're going to be living amongst.
Still lame.